All right. So I'm Dr. Phil McCary, and I'm here with Dr. Kirby Tula Gray. How do you pronounce that part?
Tewila.
Tewila. I was way
Yeah.
off.
It's all good.
Oh, that's so much cooler. Okay, cool. Yeah, Kirby is an acupuncturist. So it's a doctor of acupuncture and herbology. Is that right?
Yeah. Well, you could say herbal medicine.
Herbal medicine. Doctor of
Yeah.
acupuncture and herbal medicine. Very cool. And she's been with our clinic since about the beginning of the year. Is that right?
February.
February. Man, what a crazy time to start off in a new, like, kind of trying to build up a new practice almost.
Yeah.
Yeah, so we've been established, but it's been a little while since we had an acupuncturist, so we were just restarting that. And you were the perfect person for the job. It's been really fun having you. I love having acupuncture. I think it's a great uh, adjunct with chiropractic and massage and rehab. It's just a whole different way of looking at a problem, which I think is great. For me, a chiropractor, we're bone crunchers, and you're coming at it from a whole different angle, which is really
Yeah.
cool. Um, and I know I've really just loved your energy and the spirit you bring to the clinic. You're not afraid of tough problems, and it's just been great to have you. So, um,
Thanks.
yeah, so we want to take a minute to introduce you to everybody here, and tell us a little bit about like how long you've been in practice, and maybe
hmm
what led you into acupuncture.
Right. So, let's see. I graduated acupuncture school in 2012 and then started practicing in 2013. So, man, math. It's 7 years. I guess it's a seventh. Yeah, it's 7 years. Um, and let's see what led me into acupuncture. I mean, it's a really interesting story. I actually every once in a while a patient will ask, and I'll give the spiel. And I'll try to be quick. So the quick story is I first heard about acupuncture when I was 18, and my best friend in senior year in high school, she was like, "Hey, you should meet my dad." So I go to her house and I meet her dad, and like to this day I can viscerally remember the energy being different in that house. It was a lot more calm, like it was palpable. I can't explain it, but it would just, I really vibed with it. And then I met him, and he was super cool, like really energetic. And as it turns out, he was a naturopathic doctor, an acupuncturist, and he was a black belt martial arts instructor, and I mean, a martial artist. And what was particularly cool about meeting him too is he was an immigrant from Ecuador, and kind of as from what I remember, like came to America and kind of just like got through all the things that he had to do to become this doctor. And I really resonated with his story. And I think in junior year or sophomore year in high school, I wanted to be a doctor or therapist or something, but medical school didn't appeal to me. And I wasn't sure what I was going to do. And I'm telling you, it was that moment that I was like, eventually in my life, I'm going to do acupuncture. I just know it. But life, I mean, in high school, they don't tell you how to get to acupuncture school. So I ended up going to Seattle U. And it was when I was 26 that I finally enrolled and got into acupuncture. And I read a couple books about it, talked to a lot of people, and they had a student clinic. So I would get treated as a poor college student at their student clinic. I mean, and they treated everything. Like I had bronchitis, I had tonsillitis, like I had I rolled my ankle and I got treated and it worked. So I had also experience with the medicine, and it just I really resonated with it, and that's so basically that's how I got in it.
Okay,
Yeah.
I hadn't even heard that part of the story. I don't think that's great.
Yeah.
Yeah, very cool. So most acupuncturists that I know do not have a doctorate degree. So tell
Right.
me a little bit about how that is unique and
Yeah.
different. What's the extra?
Right. So again, as far as I know, that's the direction that our degree is heading. our degree wasn't a 2-year master's. It was like, it was kind of a 4-year degree because you're doing 3 full years, no summers off,
Mhm.
of intense study and intense like hours in clinic. And so the level of rigor in the master's program um, felt like a doctorate. But what's happening is our field is shifting, I think, now to a 4-year doctorate. And so I graduated with my master's, and luckily with folks who have a master's degree, a few schools are offering like a 1-year doctorate completion program.
Mhm.
So 5 years later, I got my doctorate.
Okay.
And it was cool because I was able to then focus on a particular concept or theme or condition that I was really interested in, as well as like the coursework that was given to us. And what it seems to be, what that 1-year doctorate's, what they're trying to focus on too, is how we can be more integrated with Western medicine.
Mhm.
So it's that whole conversation of what is integrative medicine and how do we all work together, which I really appreciate. So that's how I came across my doctorate. But eventually, everyone will probably have that.
Yeah.
Just
That's
like every chiropractor is a doctor. Yes.
yeah.
Yeah. Yeah.
Yeah. And they're moving that way with physical therapy too. Um, but
Yeah.
yeah, it's good. Does that mean you can be a little bit more portal of entry? Like someone can come directly to you. Usually they don't need a referral. Typically, is that the case, or do you know?
Yeah. Well, depending on the state, they already can come directly to us,
Yep.
which is cool. I think it's like a few states like Louisiana, you report under a doctor.
Hmm.
Um, so that's actually state dependent, but I think with the doctorate, it'll be more like across the board, like nationwide. Yeah,
Yeah.
we'll be, and then I don't know what that looks like necessarily. I guess this is like nerd talk between healthcare practitioners, but whether we will be primary care,
Yeah.
um, which I don't have an opinion on that, but it's just how helpful can we be, and what is our avenue with the patient? Yeah.
Hmm. And then, so where did being an herbalist fit in with that?
So I guess acupuncturists can choose to just get acupuncture training or get acupuncture and herbalist training. And a big, huge part, like, it's funny, acupuncture is just actually one aspect of what we call Chinese medicine, which is now moving into Eastern medicine for obvious reasons. But Eastern medicine includes acupuncture, herbs, diet, qigong, um, Tui Na, which is our Chinese massage, and a whole component. But for the layman, we're an acupuncturist does all these things, but really I do a lot, and it's
Yeah.
not just acupuncture. So my degree was I got trained in acupuncture and Chinese medicine, herbal medicine.
Herbal medicine.
Yeah.
I've seen you use herbs a lot in the clinic.
Yeah.
What's something that you like about combining the different modalities that you have, like acupuncture, Tui Na, and herbs? What do you like about that?
I just feel like it makes me more versatile, I would say, as particularly with those hard to treat conditions. Like acupuncture works on one level, herbs, I would say, really help support a patient like through the week or through their course of treatment, just like any supplement and herb, um, to really, um, well, we can't say cure, but to treat whatever symptom that they're dealing with. And Tui Na is such a different kind of massage. I was telling Holly, massage therapist that works with us, um, like Tui Na is not about relaxation. Like you're not going to find Tui Na massage in a spa, right? With
Yeah.
like lovey-dovey music or whatever. The whole purpose of Tui Na is to get chi to move,
Hmm.
because to us, pain is chi blockage.
Hmm.
So how do you revitalize the tissue and open up the channels so things can move? And so people are less tight, which is what cupping does in its way. And gua sha, which you guys, another way, another term for gua sha is scraping. And I forget what the other term is. Some guy,
Grafton is a
yeah,
name. Yeah,
yeah,
that's right.
yeah.
So if you were going to explain acupuncture to someone, or maybe saying Eastern medicine is a better question to ask, but what would you say is it that you're trying to accomplish with somebody?
Oh man, there's like so many ways to talk about it. But I have a little blurb on my own site, and I really like metaphors, and I really like using concepts to try to drive in what we do. If you never read a book, what Eastern medicine does is like, if you think about a car and you think about the engine and the brakes and like all the hardware that goes into making a car, right? And like, let's say you get that car new, 2020, brand new car. Well, like, no matter how new it is, you're not going to be able to drive that off the lot if there's no oil and if there's no gas. And so what we like to say is acupuncture or Chinese or Eastern medicine works on like the oil and the gas, the things that the energy that allows that car to become alive and move. Um, in one sense, it's not to say that we can't work on the hardware. Like, you see me working on, like, I do trigger point needling right into the muscle to get a muscle to release. But the beauty of Eastern medicine is looking at the software, and it's all about pattern diagnosis. So Western medicine is all disease oriented. It's like a 1-for-1 situation. Everyone with heart disease, well, they all get treated with the same thing. Whereas for us, someone can have heart disease, but there might be 7 different reasons why they have that. And it's dependent on the person's constitution, where they live, the chi dynamics in each organ system. And so we are very patterned focus is another thing I like to say. So we look at all the patterns in the body and then try to get to the root of what's causing that pattern, so the pattern can resolve to a person's normal constitution. If that, I hope that makes sense.
Yeah, I like it. Yeah, that's great.
It's like 7 years in, and we're always trying to find like the best way to talk about our medicine.
Yeah.
So
that's great. I never know exactly how to tell people what it is you do. I just say, go see Kirby. She's fantastic. She'll help.
Yeah. That's great too.
Yeah, that's great. So if you were to say something that you specialize in, are there particular, like 1 or 2, maybe 3 areas that you feel like you really specialize in, things you're really good at?
Yeah, definitely the musculoskeletal stuff. It's why I work well with the chiropractic office and massage therapists and PT. Working with pain issues is a big one. And really, because we're so effective, I wasn't sure if that was going to be one of my specialties, but out of acupuncture school, it was like the easiest thing to treat. Like 2 to 3 sessions, I can see a difference, which helps with my confidence, and it helps the patient know that, like, gain trust, if you will. And then with that is emotional and mental issues, whether that's anxiety or depression, PTSD. Actually, I'm a big fan of treating and helping. Another, what I like to say, nervous system issues. Like, a lot of people, because of stress, their sympathetic fight or flight system is just so out of whack. That causes all of these other issues, whether it's sleep, they can't sleep. Or sometimes that is anxiety, or they can't eat, or all of this stuff. So I love treating stress. And then as I started, in my practice years and years later, I have to treat like adrenal issues too. So just this chronic fatigue that a lot of people are dealing with. And they can't seem to um, remedy, I love treating those issues, because really I want somebody to feel buoyant and alive in their body so they can continue to do the things that they have to do. Like, I can't take away your stress, right? But they call Eastern medicine battlefield medicine. We needed back in the day to get people as 100% as they could so they can go back and fight those wars, or
Like,
go back and farm for our food. And so I kind of think about it like that. How can we help you be more resilient and feel whole and embodied in your body? And then I would say one last thing is trauma informed care. So a lot of people that have experienced trauma, whether that's childhood trauma that now is having an effect, let's say, in their adult lives, um, other traumas. And I mean, even car accidents could be traumatic for people. Like, they have they have a car accident, and then all of a sudden they're like, their orientation to driving can be fundamentally different. They're scared or nervous, or is it going to happen again? And that is a nervous system issue. They're stuck in that fight or flight. And so I see um, motor vehicle accidents as a kind of trauma, and I love treating those too.
yeah,
So,
it's great.
yeah.
I love the phrase you use or the term you use to help people feel buoyant. I love that. I thought that was
Yeah.
great. That
Oh,
doesn't mean.
sorry. And I can't forget reproductive issues.
Oh, right. Yeah, yeah.
Oh my gosh. So, like, menstrual cycle problems, people trying to get pregnant, people dealing with being pregnant, going into labor, and postpartum care. And what's cool about reproductive care is I can work from somebody who starts their period, like someone 12, 13, 10, 15, all the way up until even what is it, after their cycle's done, menopause, perimenopause, that whole thing. So it's so fun to be part of like that lifelong natural process in a female body.
Yeah,
Yeah.
yeah. That's fantastic. Yeah, there's so many things that I don't work with, or there's just so many aspects of what you do that I don't, and it's great. And we kind of joke that a lot of times if there's someone that I just don't know what to do with, I give them to you, and it's really true in a lot of ways. But sometimes I just kind of get this feeling that there's something else underneath
Mhm.
needs to be dealt with before I can really get in and do what I need to do. That's often when I end up, or now I know more about what you do, so I'm able to hear other things that people will say, and it's
Or
not.
like why is a normal treatment plan that you do not working? Oh, maybe because they're so depleted they can't even take the the care that you're giving them, or something like that. So I love to work with folks that, yeah, the hard to treat cases, because it could, yeah, it's that underlying thing that just, you help that underlying thing, and then everything else can resolve.
Yeah, yeah.
Yeah.
Great. Well, one of the reasons that I wanted to get you on camera is because a lot of people are nervous about acupuncture, and whenever somebody is, I always say, let me grab Kirby real quick, let her talk to you, and that
Hmm.
almost always eases people's fears, and they're much more willing to come and see you. And I know that once someone meets you, that they're going to feel more comfortable.
Hmm.
But what would you tell somebody? And obviously, you don't know everyone's individual situation, but what would you tell someone that's nervous about acupuncture?
From, I will say, like 90% of all the patients I've ever had in my 7 years, it's their first time trying acupuncture. And when I've talked with folks, what seems to make them nervous is the needles, right? And so it's how they're thinking the needles are going to be. Like, when we got shots as kids, or when we get shots now, they're not, that's not fun, and that's not pleasant. I mean, I myself, when people are trying to draw blood, they can't find my veins, so they're like digging in there, and it's painful and annoying. But that's not acupuncture. First of all, we're not even using hypodermic needles. Like, truly, the needles are like hair thin. Like, if I have a picture I like to show of like the needle bending, it's not hollow, it's really, really, really thin. and it doesn't hurt at all the way that a hypodermic needle does. So once I tell them that, or I get hands on them and I put that first needle in, they're like, "Oh, that's it, really?" And it's like, "Yeah, man, like that's what acupuncture is." And I think maybe it's because they can't believe that it's not a no pain, no gain. Like I'm supposed to feel pain in order for me to feel better, and that's not the case. People do feel things in an acupuncture session, but not what they're thinking. So, what I would say is just like often what you do, Phil, is talk to an acupuncturist if you're nervous and find somebody that you trust to do that with the first time. And I mean, man, once that first treatment's done, most people are like, okay, this is not what I expected. Um, yeah, so I guess that's what I would say about it.
Yeah.
Find someone you trust, and it has nothing to do with getting a shot.
That's right. That's right. Well, great. Well, thanks so much. I really appreciate that. That's mostly what I wanted to go through. And I think we're going to do a little series of these and we'll get into some more clinical stuff. But this is a great introduction. Anyone that watches this, if you want to come and meet Kirby, she's at our clinic, Laurelers Chiropractic. And you can book directly with her online, laurelerschiropractic.com. You can call the clinic if you like to. And we're happy to verify your insurance benefits. Kirby's getting on more and more panels. She was in Washington, so she was on a lot of panels in Washington. We're getting her on some more of the insurance panels down here in Oregon. And yeah, take the time. Kirby, she's great.
I hope to see you guys. Bye.
Yeah. Bye.